Thank you everyone for joining us. We will be starting in 1 minute. Please place yourself on mute. Please be aware of the video cameras that are out there. These are being recorded and online for everyone to see. We want to make sure that we're avoiding any noise distractions throughout the presentation so everyone can hear. Again, we'll be starting in about 30 seconds. Thank you. Welcome everyone. It looks like it is about 12:29, again about 30 seconds. My name is Maria James, and I want to welcome everyone to our presentation today for the transition of children's dental benefits to managed care. This is our first quarterly training presented by IME and our dental MCOs, as well as Heather Miller. I will introduce them here shortly. I do want to make sure that you're aware if you can see the PowerPoint presentation, because that's what we will be referring to throughout the presentation. So again, thank you everyone for joining us on this beautiful day outside. And just a couple of Zoom notes to take. Please put yourself on mute. It can be kind of distractive not being able to hear. Questions will be answered at the end of this presentation. That way it gives the presenters enough time to actually go through their presentation and maybe answer some questions that you might have by their presentation alone. So we want to make sure that we allow them to go through their presentation. And then at the end of our PowerPoint presentation, it will be ample opportunity to make sure you ask questions and those types of things. So the other thing is that everyone can see your video on here if you are sharing your video. So it is being shown to everyone out there. So I just want to make sure that you are aware of that. Again, so I want to get started here so that we can get on the way for the information today. Heather Miller, I want to introduce her to you. Most of you probably are aware of her and have worked with her in the past. She is the dental program manager for Iowa Medicaid Enterprise. She's a dental hygienist by trade, and Heather came to IME 3 years ago, bringing past experience working in private practice, public health, and dental insurance industry. We also have on board with us our MCOs. Our presenter today is Sabrina Johnson. She is a regional operations manager for McNa Dental. She is an Iowa native and has been with McNa Dental for 3.5 years. Previously, she worked for the Iowa Medicaid Enterprise for several years. And finally, we do also have a third presenter. Her name is Gretchen Hegman, is Vice President of Government Programs for Delta Dental of Iowa. Gretchen has been with DDIA since 2014 and previously was at the Iowa Department of Health Bureau of Family Health. So I did want to make sure that you know all of the presenters today, just in case you need to note that for later. The other thing before I begin transitioning over to Heather's presentation is if you do have questions that are specific to your organization, those would be better answered offline and to either the MCO or to Heather. So when we do go to ask those questions, I want you to keep that in mind. We're asking questions related to the PowerPoint presentation today, as well as any other questions that you might have that might be of interest to others. We want to keep this professional and to the point. We want to make sure that this is a benefit to everyone that is on board. So Heather, I want to go ahead and get you on board here.
Okay, can you still hear me okay?
I can, thank
All
you.
right, okay. Well, thank you for the introduction and thanks to everyone participating on the call today to learn more about the transition of children's dental benefits to managed care. Next slide. To begin, I wanted to start this presentation with making you all aware of a couple resources released that are related to this subject. There are two informational letters. Informational letter 2189 was released in November, and it really was a courtesy to providers to let them know about this upcoming transition. The next informational letter, 2217, was actually just released yesterday. It's in a question and answer format, and what we tried to do is we tried to address the high level concerns brought up during the public hearing comment period. Both of these letters can be found on the IME website if you'd like to look them up. But just so you know, for the first part of today's presentation, we'll actually go over each of these informational letters. The second half of the presentation, then we will get into more specific questions or concerns asked as a result of either the informational letters or the public comment period. Next slide. So essentially, this transition is a shift of administration from Medicaid fee-for-service to managed care. Iowa Medicaid already contracts with two dental plan administrators. They are called, we actually refer to them as preambulatory health plan. You'll hear me refer to them as PAPs once in a while because that's how they're designated. But we already contract with them to administer the adult dental wellness plan benefits. The target implementation of this transition is July 1. That is contingent upon the approval from CMS. And this does impact children ages 0 through age 18 years of age. But I did want to make clear that this does not impact the Hawkeye program. Delta Dental will remain as the sole administrator of that program and has no impact on this transition. Next slide. So IME truly believes that this transition is in the best interest of our membership, and we wanted to share some of the supporting talking points. Um, First of all, members will have a choice in benefit administrator. So there's federal guidance that supports that Medicaid plans allow their beneficiaries freedom to choose their health care coverage. And this allows them to pick a plan that best fits their individual needs. So this transition supports that guidance. Another reason is because families can now be enrolled with the same administrator to eliminate confusion, not only for members themselves, but for providers too. So I mentioned that we've already got the adult population with either Delta Dental or MCNA, but the kids have remained in fee for service. So this transition will allow them to all be under the same plan administrator. It's also anticipated that the dental plans will have more provider influence and less administrative burdens to create better access to care for members. The dental plans are allowed, they have a little bit of flexibility that IME does not, and we're going to talk about this a little bit later in the presentation too, but they actually have the ability to adjust the fee-for-service
So,
reimbursement rates to 100, up to 105%. And again, we'll talk more about that later. One of the things we wanted to maintain throughout this transition, though, was the iSmile program. So the iSmile program, I'm sure many of you are aware of it. It's a great program that provides outreach and education, care coordination, and direct services for the child health population. And we do this through an interagency agreement between the Department of Public Health and Iowa Medicaid. And throughout this transition, that is infrastructure that we definitely want to maintain. And lastly, this transition allows for a more predictable budget for the state to manage. Oh, I think okay, now I'm on the right slide. Um, the name of this program is going to be referred to as Dental Wellness Plan Kids, and you can see the logo there on the right. So it's very familiar, looks very familiar to the adult logo. We just added the word kids underneath. There are federal requirements that must be upheld in regards to the dental benefit packages offered to children. The current dental benefit package will remain the same. That's something I just wanted to make very clear that all the services that are available to children now will be transferred to during the transition. So the other thing is that children will not be subjected to an annual benefit max or the healthy behavior requirement like the adult program. So I just wanted to make that very clear as well. Next slide. A little bit about member notification and assignment. Basically, members will be receiving 2 mailings. The first mailing will be in March, and it will be to notify members of this transition. The second mailing they get will be in June, and it will actually notify them of which plan assignment that they've been assigned to effective July 1. Now, members will have 90 days, so up until September 30th, to request a change from one dental plan to another if they choose. After that, beginning October 1, members must meet good cause in order to switch from a different dental plan to another. And I'll talk about that next on the next slide. But in addition, members will still have their annual choice period where they can change dental plan administrators as well. Next slide. So with the good cause reasons, I just wanted to make it very clear that those are determined by Iowa Medicaid and not by the dental plan. So we will decide whether or not a member has good cause to switch from one plan to another. Some examples might be if a member has an established provider that is not enrolled in the network that they've been assigned to, that would be a reason we could switch them from one provider to another. Another example would be if a member needs services from multiple providers that aren't both in the same network, we could make that change for that reason as well. Another reason would be is because a provider has been terminated or no longer participates with the member's dental plan, or if we determine that poor quality of care has been given by one of the dental plan administrators. There's a lot of information on good cause on the IME website, and that link will take you there. In regards to thank you, Maria. Next slide. In regards to member outreach, IME will provide choice counseling to members to answer questions and identifying factors to consider when choosing a dental plan. This is something we already do for the adult population that we will continue to do for the child health population. However, IME will not be notifying members if their provider is enrolled in the dental plan network that they've been assigned to. One of the things I wanted to just point out is that I just wanted to make providers aware of the fact that CMS considers it inappropriate for health plans to, or providers to promote one plan or another. They consider this provider steering. So providers are not allowed to provide unsolicited advice or do mass marketing mailings to influence a Medicaid recipient's choice in who they enroll with or not enroll with or disenroll with from a particular health plan. But that's not to say that providers can't inform members of which plans they are participating in. It's just that steering part that we want to encourage you to stay away from. Next slide. Can we go back one? There we go. In regards to member eligibility and plan assignment verification, it's important to note that IME is the source of truth for both member eligibility and plan assignment. We have our eligibility verification system. We call it the ELVsign, which is available 24/7. So there's a portal option and there's a phone option to confirm. The dental plans both have the same options as well if you'd like to use their services or if ours is down or whatever it may be, but they both have the provider portals and the telephone verification systems as well. As a reminder, just like your commercial patients too, it is the provider's responsibility to assure a member is eligible before providing any services to them. Next slide. In an effort to make this transition as seamless as possible for members and providers, we've implemented some continuity of care policies. Excuse me. So for prior authorizations, what we plan to do is we plan to submit a file to both Delta Dental and MCNA with services that have been pre-approved. So they will get a list of all prior authorizations that have not expired through September 30th. And they will honor those. Same thing for claims. So any claims that are submitted by a non-network provider will be honored by the dental plans through September 30th. We realize that this transition is going to surprise some. We didn't want to hold members liable. We didn't want to hold providers accountable. We just thought this would be a nice way to hopefully help with this transition. And then in regards to emergency services, any non-contracted provider rendering services to a member in an emergency situation will be reimbursed the fee-for-service rate even after September 30th. Next slide. Okay, so that was kind of the high level overview of the questions that we received from the public hearing sessions, in addition to the informational letters. So the second half, we'll get more into the specific provider questions that came about as those from those same I'm at a loss for words, from either the public comment period or the informational letter. So what I'm going to do is I'm actually going to read the actual question that was asked and then provide an answer, and you'll be able to see the answer reflected on the slide. So the next slide. The first question we received is, will the rules for prior authorization services be administered the same way for all plan administrators participating? For instance, in my previous experiences, one group requires radiographs and the other does not. This creates administrative burdens. So the good news is that all three payers, so Delta Dental, MCNA, Iowa Medicaid, we have all worked together already and streamlined all of the services requiring prior authorizations. And we've taken a look and we don't anticipate any new prior authorizations to be added for this transition. As far as supporting documentation criteria, there may be some differences, but this would be just like other patients in your practice with commercial coverage, calling for different submission requirements. I do know that the dental plans are currently working on updating their provider handbooks, where the supporting documentation requirements will be outlined. Next slide. The next question we received is, how many children will be impacted by this transition? So currently there are 270,227 members enrolled and approximately 163.5 households. There are some excluded populations, so there are some children that will not be assigned to one of the dental plans. You can see a list of those populations there. But just to give you an idea of the volume of members likely staying in fee-for-service, on the adult side, we have the same excluded populations and there are more members enrolled. There's over 390 or almost 390,000 members enrolled. And we have less than 2,500 enrolled in fee-for-service. So if that helps you kind of understand how few fee-for-service members there will be, I just wanted to provide that as an example. Next slide. The next questions received, there's two here. They're related to children in foster care. So the first question is, will foster children be assigned to a dental plan administrator? And the second question is, for children that are in foster care, is there a mechanism that can move between plans easily to fit the need of the child getting care? On the excluded list, you did not see foster care children. So foster care children will be assigned to a dental plan administrator. And this parallels the medical side as well. And then the same process applies to foster children who would like to switch dental plan administrators. So within the first 90 days without cause, after 90 days with cause, or during the member's annual enrollment timeframe. I did want to note that as the program manager, I do have the authority to consider member assignment on a case-by-case basis. In foster care situations would be a situation where I could definitely review the circumstance and make a determination based on findings. Next slide. Okay, the next questions, there's two. The first one is, will children be enrolled with the same carrier as their parents? The second question is, will plans be required to balance patients? For instance, if one plan is accepted by more providers, but the patient is assigned to the alternative plan with less providers, will they be restricted from moving to the plan where their providers are located due to burdensome rules that require the plans to be balanced? So there are federal rules around distributing members equally among plans, unless there's some performance issues. And I'll talk a little bit more about readiness review and things like that here in a little bit. But just know that the IME algorithm that has been written will balance the membership, and it will take into account keeping families together and past history of a plan assignment. In addition, for those Hawkeye kids, I mentioned earlier that Delta Dental is the sole administrator for the Hawkeye program. If one of those Hawkeye kids moves to the Dental Wellness Plan Kid program, they will stay with Delta Dental of Iowa. That is already figured into that algorithm that IME has written. So next slide, please. Okay, the next question is, how will IME ensure that MCNA and Delta Dental each have a robust provider network? So there are federal requirements that the plans must meet for readiness review. Iowa Medicaid contracts with an external quality review organization. So this is a neutral party that will be conducting that readiness review on behalf of the Iowa Medicaid enterprise. It will begin at least 3 months prior to the effective date of the transition and will be completed in sufficient time to ensure smooth implementation. The state must submit findings to CMS to allow them to make a determination that the contract amendment transitioning enrollees to the dental plans can be approved. So there are 4 categories that the readiness review will really dive into. The operations and administration really looks at the staffing and resources that the plans have, delegation and oversight, enrollee and provider communications, grievances and appeals, member services and outreach, provider network management, and program integrity and compliance. For service delivery, they really look at case management, care coordination, and service planning, in addition to quality improvement and utilization review. For the financial management, they look at financial reporting and monitoring, and then financial solvency as well. For the system management, they really take a good look at each of the dental plan systems and how they can manage claims, in addition to encounter data and enrollment information management. So next slide, please. This question is, will the plans change significantly after the first year? In my past experience, there were little changes initially, but year 2 required significant restructuring, including the burden on providers. Increasing the burden on providers. So I think this question really references the Dental Wellness Plan Adult Program that is administered through a demonstration waiver. And so for the adults, that demonstration piece originally was designed as like a tiered benefit structure. So basically, the more preventative care a member received, the more restorative care they earned. But after considering the evaluation and the monitoring outcomes, the decision was made to change the plan design after the second year. However, I wanted to make it clear that, again, the Dental Wellness Plan Kid program will not have those same requirements. There is no healthy behavior requirement. There is no annual benefit max. And so we really do not feel like there will be any significant restructuring that will add burden to providers. Next slide. The next question is regarding ortho. Will ortho processing policies differentiate between the plan administrators? So talking to Delta Dental and MCNA, it sounds like we are very similar in how we process ortho claims. We will all 3 require prior authorization. All of us require a minimum score of 26 on the Salzman tool, and we will all accept electronic or 3D models or cast molds. Next slide, please. So I wanted to talk a little bit about provider flexibilities, and I kind of had to lump the concerns into just one overall arching statement for this one. So there was just a lot of concern expressed from providers related to contracting with the dental plans for the all-encompassing dental wellness plan program that will now include adults and children. Um, so the flexibilities that providers have is that they can limit the number of members they accept into their practice. And they can also limit which populations they choose to see, whether it's adults or children or combination of the two. So while providers are held to a non-discrimination obligation, it does not require a provider to accept every Medicaid patient seeking services. Providers have the ability to make decisions to sustain their business. There is no state or federal law that requires a practice to take every patient that seeks their services. From an IME perspective, in an effort to ensure no disruption of care for members, we would love to see providers participate with both dental plans, but there is nothing requiring providers to do so. Next slide, please. So to follow up on that, I wanted to highlight some of the flexibilities that the plan administrators have. So we talked a little bit about how, and sorry, the question is related to the informational letter. There's a statement in there that says we anticipate the fee schedule will remain relatively the same as it currently is under fee for service. When will providers be given specific information about the fee schedules and plan details from each of the carriers? So I know that the dental plans are currently recruiting providers into their network. I assume that providing the fee schedule is a piece of that recruitment effort. I mentioned before that the plans do have the ability to set their own reimbursement rates up to 105%. Now the dental plans will receive their capitation rate based on the Medicaid fee for service at 101%. So, there's not a ton of flexibility there, but there is a little bit. Um, the dental plan administrators also have the ability to offer value-based services and incentives to providers. So those value-based services are, they focus on proactively preventing dental disease rather than reacting to it, a little different way of thinking about how to reimburse for dental services. Those are things that we are willing and definitely want to explore. We think it's a great way to deliver care. It's just, we have to, the plans do need to seek approval from IME before we can move forward with those. Next slide, please. This question is, what will the administrative cost of this program, of this new program, as it compares to the current fee-for-service program? So the main difference between fee-for-service and managed care is that managed care plans have the ability to offer member and provider incentives and reduce healthcare costs and utilization. So essentially, the dental plans accept the risk related to their enrollees' healthcare costs. Again, the dental plans will be paid a capitation rate for each member assigned to them based on that fee-for-service reimbursement. The Affordable Care Act requires the dental plans to submit encounter data on revenue spent on clinical services and quality improvement. And we do have protective measures in place to protect the state and federal funds and mechanisms in place to assist in the adequacy of negotiated provider reimbursement rates. For example, the state has established a medical loss ratio to ensure state funding is spent on the delivery of services to members. And so what this MLR cap does, the proportion of state dollars that can be spent by the dental plans on non-healthcare related services such as administration, marketing, and profits. So it puts a cap on those, what could be spent on those things. The state will recoup funding if a dental plan does not meet the required medical loss ratio. In addition, if insufficient provider reimbursement impacts access, there are contractual safeguards in place. So essentially, for every dollar that the dental plans meet, 88 cents of it must be spent on member care, or it has to be returned to Iowa Medicaid. Next slide, please. Okay, so for this slide, we received 3 questions. So the first one is, will we now have to get prior approval for GA cases from 2 entities? So for general anesthesia cases, will approval be needed from medical and dental? The next question is, will we have to go through the same administrative burden to prior authorize sedation cases as we do for general anesthesia cases? The last question is, what will the pre-authorization requirements be for taking children to the hospital to be treated under general anesthesia as well as in-office sedation? Okay, so I'm sure many of you are aware of this, but the dental plans do cover in-office sedation, and they do cover dental services provided in a hospital setting. The in-office sedation provided by the dental plans does not require a prior authorization. For the services provided during that same visit where the in-office sedation was needed, that prior authorization is ideally needed prior to treatment. But we wanted to clarify too that we understand that you don't always know what you're going to get into until you get in there, especially if let's say it was a child with behavioral issues and you had just a limited opportunity to look in the child's mouth visually. IME, Delta Dental, MCNA, we will all three consider either like a retro prior authorization or a post-treatment review after the services are completed. As long as the clinical documentation and the radiographs can support the medical necessity of the service, it could be processed that way. Now, the medical plans are the ones that cover, excuse me, the anesthesia and facility costs when provided in a hospital setting. There have been no changes to the MCO process for hospital cases as a result of this transition. Next slide, please. Okay, this question is, will there be only one administrative body even though there are two plans? And then the next question is, how will we evaluate the effectiveness of this change? And will there be a mechanism to return to a fee-for-service model if there is clear evidence that we are harming Iowa children? Okay, so the state is committed to ensuring that dental plans are in compliance with contractual state and federal requirements, in addition to assuring that this is improving member experience. There are many committees and there are many committees that DHS and IME reports to. For this transition alone, we've already presented to the Health Policy Oversight Committee, the IGov team, Iowa Caucus, and the Medical Assistance Advisory Council. So Iowa Medicaid has already instituted a variety of oversight activities, which will continue through the transition of children to this new delivery system arrangement. So basically, all of the things that the plans do for the adult population, they will also do for the child health population. To provide a little insight, the dental plans submit a variety of monthly, quarterly, and annual reports on operational, access, and quality metrics. IME staff then reports any problems, issues, or discrepancies, and they are acted on right away. Additionally, the dental plans undergo an annual external quality review, on-site compliance review to assure that the federal elements are all met. There was some reference during the public hearing to the role of the Iowa Insurance Division, and I just wanted to clarify that just like the MCOs, the dental plans are obligated through their certificate of authority with the Iowa Insurance Division to report and file certain things. But this does not mean that the Iowa Insurance Division provides oversight. The oversight comes within the contract between DHS and the dental administrators. I hope that answers that question. Next slide, please. This question is, actually there are two. The first question is, will those receiving cases be like providers? Those reviewing cases be like providers? So for oral surgeons, will they be reviewing oral surgery cases, and same for pediatric dentists with pediatric cases? Will the provider network for specialists be the same for all of the dental plan administrators across the state? So Iowa Medicaid, Delta Dental, and MCNA, we will continue to establish our claim review process already in place. And it does for all three of us. It includes dental specialty providers that are available for consultation. As far as if the networks will be the same, it really just depends on, provider contracts that are established with each of the vendors, with each of the dental plan administrators. Next slide, please. This question is, in a multi-provider practice like the one I work in, will there be the same burdens that the health plans have placed on needing to know exactly which provider will be providing care? I'm not sure I'm going to answer this one correctly, and whoever asked this question is more than welcome to follow up with me afterwards. But any claim that is submitted to Iowa Medicaid, Delta Dental, or MCNA must identify the treating and rendering provider appropriately. That's just a program integrity measure that is, required from providers. As far as, I'm not sure if I answered that one correctly. So again, whoever asked that, if I didn't answer that, what you intended me to answer, please let me know. Next slide, please. This question is, for a safety net with all the specialists in the state, like where I work, will we be given specific and direct lines to discuss concerns with plans and get expedited authorizations since we are serving the entire state with specialty care? Yes. All three payers have provider hotlines. Delta Dental, they're all listed there, Delta Dental, MCNA, and Iowa Medicaid contact information for provider hotlines to discuss concerns on specific cases is something that we offer. The next slide, I think that might be it. Okay, so that is all I had as far as the presentation goes. This email I wanted to provide to let you know that we're going to go to the chat feature now to ask any outstanding questions you have. But if you don't feel comfortable asking your question today or want it addressed privately, you're more than welcome to send that to this email address and we will follow up at a later date. So with that, I will go ahead and look at the chat questions here.
Perfect. Thank you so much, Heather. I appreciate it. And again, if you do have specific questions, all the MCOs as well as Heather will be available for you to ask those specific questions. So it looks like if you want to go ahead and start typing into the chat box some of your questions. I know there was some questions as Heather went through that she didn't know if she was able to answer for you, so that this would be a great time for that to see if she did answer those for you. So as you see those come in, Heather, are you able to read some of those?
Sure, you bet. One of the questions was, will we be able to obtain the slide deck? And another question kind of related is, will we be able to print this off today? I'm going to actually ask Mike that.
Yes, the slide deck has actually already been posted to the DHS website, and I dropped it in the chat. If people would like, I can also email it out as well.
Sorry, I didn't scroll down far enough. I see you had already answered that, so great. Let's see here. Let's see. Will you include in your letter for the parents or guardians to contact their dental office to find out if they are providers for the administrator that they have been assigned to? Is Kevin Kirkpatrick on the phone? That is something we could probably consider.
Yeah, this is Kevin. I think that's a good suggestion that we can include in the assignment letter. We've prepared a letter going out in March to kind of give a general overview of this is coming, and people aren't going to know their assignment, and providers I don't think have finished all their credentialing by that point, so we won't put it in there, but definitely when we send out the assignment letter in June, that is a good point. We can include that information in there. Thanks for that suggestion.
Okay. Let's see. There is a question regarding the MCNA hotline. Sabrina, I'll let you decide if you want to take that offline or answer it now.
Sorry, can you hear me now?
I can now.
Okay, hi, everybody. So yes, I can take that now. Now that we are transitioning children into a dental wellness plan, kids, and the hotlines have been educated with the new process of enrolling providers and answering questions. Our corporate office is actually located in Florida, the call center, but I am here in the state of Iowa. So they needed to reach out to me and ask questions. And the information or the Iowa Provider Relations email address that Heather provided in this presentation will actually get those questions directly to me.
Great, thank you, Sabrina. The next question is, will MCNA and Delta Dental pay for services rendered prior to 7/1 if we do not get them submitted prior to that date? So I just wanted to clarify, any services provided to children prior to 7/1 should be submitted to Iowa Medicaid. Delta Dental or MCNA, would you like to comment on that at all? Okay. What is the definition of an established provider? That's a good question. So basically, if we have a member call in and say, hey, I really want to switch to this provider but he doesn't accept my insurance plan that I'm assigned to, but I've been a member there for years. We will go back to that provider and we will ask them if this member is truly an established member. If they've been there within the last year, we will more than likely grant that member to be able to switch from one plan to another to continue that relationship with that provider. The next part of that question is, if I do an orthodontic exam but have not initiated any treatment, am I an established provider? That's another really good question. Again, I would think as long as there was a visit within the last year, we would be able to grant that good cause exception for wanting to stay with an established provider. Delta Dental or MCNA, do you have thoughts on that? Okay.
So Heather, I think the only thing is that for this first 90 days, so July, August, September, a member has the opportunity to change for any reason and would not need good cause until after or until October 1st, correct?
Right, right. Okay.
Heather, did you see the one did I happen to miss that I called MCNA hotline yesterday?
Yeah, nope, I think Sabrina got that one. Yeah.
Okay, good.
Yeah,
Right.
yeah. Let's see. Question, will we need to recontract with the dental MCOs since we can now negotiate the fee schedule? And will this also be the case for the adult program? So I might open this up to the dental plans as well. My understanding
is—
is—
Home Goods before we leave.
Hello? Somebody's not on mute, just so you know. So, you know, I think the plans have established their fee schedules, and whether you negotiate new rates with them is between you and the dental plan administrator. And I guess the same could be true for the adult program as well. But it's up to the plans to make those decisions.
Heather, this is Sabrina.
Go for it.
And I don't recall which number the slide is on. You had explained that the dental plan's limitation on provider fee schedule is in our contract at 105%. MCNA does have their fee schedule posted online, and it was provided in the recruitment packets to providers.
Great, thank you. The next question is about, it might be from a member perspective, offices accepting Delta, not accepting MCNA. What's going on with that? So Delta Dental is well known in the state of Iowa, of course. MCNA is well known in other markets for administering children benefits. It may just take them a little bit longer for providers to get more acquainted with them. Again, because they are so well known in other states for administering children benefits. And they do administer a population for the adult in Iowa too, but maybe just not as well known as Delta Dental of Iowa. Let's see. Will the attachments that are required for adults be required for kids? So for prior authorization, am I understanding that question right? For like prior authorization services, are the same supporting documentation required? So there's not a whole lot of services for children that require prior authorization. Let me just start with that. But if a child would need a crown, then yes, the same documentation or the same supporting documentation would be required. So if it helps, just, it's based on service, not by age. So if the service requires supporting documentation, then that applies to children and adults. Will we have different payer ID for wellness kids? Yes. I hope I understand this question correctly. So the members will have payer ID. I better turn that over to the plans. Delta or MCNA?
So Heather, this is Sabrina. I think this may be a question based on Delta and the commercial side, maybe, but we don't have payer IDs necessarily for Medicaid, the Medicaid population. And I believe that we're still going to use the Medicaid ID number that's assigned by the IME when we issue them their plan specific card.
Okay. Delta, do you have anything to add?
Gretchen.
We might have lost Gretchen. Gretchen, we can't hear you if you're trying to talk. Okay.
Heather.
I think Gretchen's having some sound issues.
Okay.
Heather,
Yeah.
this is Donna Glanz.
Oh, hey,
And
Donna.
we do have a separate payer ID for the program. And it's going to
Okay.
be listed on all the documents that we send out. But it's the same payer ID we use for the government programs currently, in existence. So that it will be the same as that.
Okay. Thank you,
But
Donna.
we will put that on all our communications for them.
Perfect. Thank you.
You bet.
Okay. The next question is, do we need to pick either MCNA or Delta Dental, or can we sign up to be providers for both? Absolutely, you can be providers for both. We would love that. What are the benefits or disadvantages for signing up for both? The advantages, from a member perspective, it would just be so great if members would have access to a Medicaid provider, regardless of the fact of who they're assigned to. The disadvantage would maybe be that it does require providers to contract with both plans. There is some administrative work that needs to be done on the forefront, but other than that, I think it would just be a wonderful thing to have the ability for members to be seen by your office, regardless of what payer they've been assigned to. Delta Dental or MCNA, would you like to add anything to that?
I think you did a good job, Heather.
Okay. This one. Let's see, Sabrina. Are you following along in the chat? Are you comfortable taking this one now, or would you like to take it off-site?
Well, I am definitely trying to follow along in the chat, and I'm super excited that we are getting a lot of questions. So I can attempt to answer this, but this may be definitely more of a network development type question. We're not really, these definitely are goals and requirements that we would like providers to meet. And we understand that right now with COVID, things have really changed how offices are practicing and how many members they can see at the time. So I think that this really is our goal. It's not something that we put providers on corrective action for. We follow up and try and figure out what can we do to assist that provider's office. So you can reach out directly to me, and I can get you in contact with network development. They'll be able to give you more information about what these particular requirements are and how they ended up in our agreement. Okay.
Thanks, Sabrina. Okay. The next question is, how long will a prior authorization be active for once accepted? And how long is it anticipated that these prior authorizations will take once submitted for scheduling purposes? That's a great question. I'm going to turn that over to the plans.
Heather, this is Gretchen. Can you hear me?
Oh, yes. Yay. There
Sweet.
you are.
Okay. So claims and prior auths for Delta Dental are 365 days. So 1 year they're good for. And then our prior auths are usually reviewed within 5 to 7 days.
Great. MCNA, how about you?
Yep. So both MCNA and Delta have the same 365-day approval. And then our prior authorizations are also turnaround in 5 to 7 days. And maybe we should also mention that if it's an emergency 72-hour turnaround, emergency services don't require a prior authorization. However, we would like information to be submitted on those services.
Okay, great. Okay, the next question is, can the various plans inform the members of the various dental specialists and not just group all providers as dentists? We are an orthodontic office. We are getting lots of calls seeking general dentists. And I thought both of your network or your directories did that. Am I not remembering correctly?
Deltas you can definitely sort by provider type.
MCNA, does yours have the same ability?
Yep, it does have the same ability. And for us, though, it's a little bit different, Heather, because we do not currently have any of the children's population. We're not part of Hawkeye. And obviously the transition of fee-for-service children is happening now. We didn't have a lot of pediatric dentists or orthodontists in our current network. And so, but that option to sort them in our provider directory is available.
Great. I'll take this back. Maybe it's IME that's causing the confusion. I will look into that to see if our directory does the same. I can't quite remember, so I will look into that. So thank you for that question. The next question is if I sign up to participate with MCNA, am I allowed to restrict my participation to patients 25 and under? And yes. MCNA, would you like to add anything?
I think just to make sure that providers understand, there is a section on your provider agreement and contract that indicates the age of your patients. And if you could just put that on there, we will make sure that it is displayed in our provider directory as such.
Great, thank you. The next question is, how many current fee-for-service providers are there seeing children? And that is a really great question. It's a little bit hard to answer, only because I've got at my fingertips, the number of providers that are enrolled in Iowa Medicaid fee-for-service. What I don't have is how many of them are actively seeing patients. So if I could, Shelley, I would love to be able to follow up with you after this directly to see if there's a way I can query, the number of providers that have submitted a claim in the last year or something like that. But it's going to take a little bit of work and I can't answer that right now, but I will be able to.
Did you want her to send you an email directly?
Sure. Yep. Let me give that to everyone right now. It is H Miller and then the number 2 at dhs.state.ia.us. Okay. Let's see. If you sign up for DWP Kids, will the website show that you only take kids or all DWP patients? I'll turn that one over to the plans too.
All right, so this is Gretchen. As part of our contract, we have one contract that's for adults and kids. And if you only want to see kids, you just need to let us know that, and we'll put you as not accepting adults on our website. And same for adults. If you only want to see adults, we'll put you as not accepting for kids.
Okay, MCNA?
Yep. So here's Sabrina. It's actually on page 9 of our agreement, and it states the age range, and that drives our provider directory as well.
Perfect. Okay. The next question is will they randomly change from MCNA to Delta Dental like they do with adults now? So this is a beast of the Medicaid program. For whatever reason, members do go on and off quite a bit. And I will, Amber, I will try to, and maybe you can shoot me an email too. There's a certain amount of time, if a member goes off but comes back on, they will get assigned back to their original plan assignment. If it's after that a certain amount of time, there is a chance that they just go back into that pool of assignment. So there's a chance that they could be assigned to a different plan than they had before. I want to say it's 90 days, but I don't know if that's correct. So I'd like to follow up on that for you if I could. So if you could shoot me an email, that'd be great. hmiller2@dhs.state.ia.us. Let's see. If we only participate with Delta Dental and a patient is assigned to MCNA, how does that patient change to Delta Dental? Okay, so we talked about it in the presentation, but I'll go over it again. So when a member gets their assignment July 1, they have 90 days to switch for any reason. Doesn't matter. We don't care. They can switch. All they have to do is call us, fill out a form, send it in, and we will switch them. If it's after that 90 days, they do have to meet that good cause criteria. So they have to have a valid reason for wanting to switch plan carriers. Those are reviewed by Iowa Medicaid, and we will consider all reasons and make that determination. Members also have their annual choice period where they can just, for whatever reason they want, they can switch carriers. So the members do have quite a few opportunities to make a change in plan carrier if they choose to. Let's see. What if the child is seen by a general dentist and referred to a pediatric dentist, and the pediatric dentist does not accept the plan the patient is on in their community, and they don't have the ability to travel? Will you allow them to switch? This is something we would have to consider under that good cause. And Dr. Johnson, I would love to follow up with you afterwards on that. I just want to make sure that I am following the good cause protocol as I'm supposed to, and I want to look into that for you. That's okay. Okay, let's see. If we are specialists that are consulted, patients sent to us for a specific reason, but the previous provider accepted both MCNA and DDIA, but our office chooses to only accept one, how will this patient's care be affected by this? Would they be paying out of pocket to see us? And then once we initiate care, are they allowed to switch? Okay, so this is another reason we may be able to switch a member from one plan to another. Member pay issues, there's very, very few examples of when a Medicaid member can actually be held responsible for payment. As far as once care is initiated, are they allowed to switch? I don't think that is a factor necessarily, but those other things are. So let me get back to you on that one too. I just want to make sure I answer those correctly. Do either the dental plans have any comments to make with those?
So Heather, this is Sabrina. I think one of the things providers may not be aware of is that in certain cases, the dental plans are allowed to do what's called a single case agreement or a letter of agreement. So if a member maybe was referred to a specialist that isn't maybe contracted with MCNA, it is possible to do a single case agreement to be able to provide the services this child needs at this time, but not be fully contracted.
Great, thanks Sabrina for that. The Next question is if MCNA and Delta Dental will be able to set their own reimbursement amount for procedure codes. Will they also be allowed to determine what codes are covered services? No. We require the plans to make sure all of the services that are allowed under the dental benefit package be covered under their administration as well. If I am already a provider for dental wellness and MCNA, or maybe for Delta Dental and MCNA, do I have to do anything as far as credentialing to now see kids on these plans? I'll let Delta take that one first, and then MCNA.
Dr. Weber, you're already seeing adults through dental wellness plan. You do not have to do anything to see kids. We sent you that amendment, and so you'll be on our directory.
And Dr. Weber, this is Sabrina with MCNA. You are also contracted with MCNA and won't need to do anything else to be able to see children.
Great, thank you both. Okay, yes, we'll follow up with the MCNA hotline directly. Will both plans pay for a panel if out of frequency for orthodontic treatment due to needing current diagnostic images for tax planning purposes? MCNA, want to go first on that one?
Oh, I'm sorry, Heather. I was still on the one before that from Dental Associates of Manchester. It looks like they maybe didn't hear my answer.
Oh, sorry. I thought they wanted you to follow up directly afterwards. So yes, please go ahead.
Well, I absolutely can follow up afterwards. Our corporate office is located, our call center is located in Florida. We have a call center in Florida and Texas. However, I am located in Iowa, and communications, because this is a new transition and we're going through readiness review and things like that, information to the hotline is not as complete because we wanted to make sure you guys all had the questions and answers. So the MCNA Iowa provider email box is the best way to get questions directly to me, and then I can respond appropriately. I am also working on communications to our call center so that they've been brought up to speed on all the transitions going on in Iowa. Did that help?
Sabrina, what is that email address that I should put in the chat box for that?
Yeah, it's Iowa _ I don't remember what slide it's on. Iowa _ I don't use it very often. Hold on just a second.
No worries. Thank you.
Yeah.
And again, I'm putting that email or that address in the chat box for everybody.
Yeah.
All of these questions and answer will be posted out on our website, as well as your PowerPoint presentation. But this should get to the providers quicker, some of this information that we're typing into the chat box here today.
Yeah, and Maria, it is on slide 26 of Heather's presentation. It might be a little difficult to see because it's all underlined. So it is IA _
Oh,
PR
just a second.
_
So it's IA _
PR _
underscore. Okay.
DEPT at mcna.net.
All right. Thank you so much for that. Appreciate it.
Yeah, you're welcome.
Okay. Let's see. I know you answered that one and didn't have time to think about the next one. Do you want me to go to Gretchen first for the panel question, or?
Sure, go ahead. It's Gretchen's turn.
All right, Gretchen. So will your plan pay for a panel out of frequency for orthodontic treatment due to the provider needing current diagnostic images for tax planning purposes?
Yes, our panels.
Is it treatment planning? I think it's treatment planning purposes. Sorry.
Okay. Yes, so the panel for ortho will be allowed out of frequency.
Great. MCNA?
Sorry, I couldn't unmute. Yes, we'll follow the same protocol.
Great. Okay. If we sign up with MCNA and Delta Dental and end up finding out one plan has a significant administrative burden or quality of care issue, how do we disenroll from one plan and not the other? I'll let the plans handle that. let's let Sabrina go first.
Okay, so let me read it again. I think it would be very helpful, and I won't speak for Gretchen, but I think it would be very helpful if the dental plans were given the opportunity to correct whatever burden or quality of care issue the provider feels that they have before they would go through disenrollment. I feel like the opportunity to correct whatever issue the provider may have would be beneficial to the provider's office and the member.
This is Gretchen. I could just add to that. So our contract does, if you do want to disenroll, we just allow a 60-day notice on that. So then we can notify the members and help the members find a new dental home.
Great, thank you. Let's see, the next question is, we have a large portion of our patient population that jumps almost monthly from Hawkeye to Medicaid and will often switch mid-treatment, where 1 month they fall under one and the next without parents realizing they've switched. How will this work with an MCNA family if it happens so often? How will they jump to Hawkeye and then jump back to DDIA Medicaid? This constant jumping around specific to children does not seem to be beneficial to MCNA as a partner. Let's see where to begin here. Okay, so members switching from Hawkeye to Medicaid. Is there anybody from member services on the call that could help me with this one? No, okay.
Hey, Heather, it's Sabrina.
Yeah.
I'm
Okay,
here, Heather.
Oh, there you go.
Was that you, Vicki?
Yes, it is. What's up? What
Hello.
was the question?
Well, and I don't know, so I think I might need to take this one back, but the concern is about children bouncing between Hawkeye and Medicaid
Mhm.
and mid-treatment. And how do we notify families that their child has been switched from one plan to another?
Well, that's all done through eligibility. And
Okay.
my understanding is, I don't know how the treatments work, which treatments they're talking about, but my understanding is that whether they're on Hawkeye or whether they switch to the DWP for kids, they're going to stay with Delta Dental. So
Right.
they're still going to send those claims to Delta Dental. I don't know if there's a different pay rate between the
There
two.
is.
So that's,
Mhm.
that's when the questions come out.
Okay, yeah, there's definitely a different fee schedule, reimbursement schedule for that. So, but keeping them at least with the same provider will help, I think. But how will this work with an MCNA family if it happens so awesome? So again, that algorithm that our core team, our IT team that they've written, it will automatically move those kiddos to Delta Dental, but then the algorithm will assign other members to MCNA. I don't know if this is related to like that balancing question. I'm not sure if that answers that question at all, and I can definitely follow up afterwards if that didn't help.
Are they talking about the way, if a member if the kids are already on Hawkeye and mom and dad come on regular, through the regular process, then the kids, for some reason the kids drop off a Hawkeye, go to DW Kids, they would be on Delta, but mom and dad
Oh, mom, it would,
could
yeah,
get
yeah.
could be
Mhm.
on MCNA and they would have to make a choice to change.
Okay, yep. Maybe that is what the question is. Thank you, Vicki,
Mhm.
very much.
Heather, this is
Yeah.
Sabrina. I think one of the benefits right now to having the fee-for-service children moved into DWP Kids, especially in relationship to Hawkeye and Delta Dental having their population and then any member that would switch from Hawkeye to Delta Dental, rather than switching to fee-for-service as they're indicating in this question, they'll still be assigned to Delta Dental. So this may actually remove that administrative burden that the provider is seeing today.
Great, thanks, Sabrina. I can follow up if you want to email me for more information on what your question is. I can definitely follow up with you on that afterwards. I'm not sure we did a good job with that one, but We're going to move on. The next question is, we currently participate in fee-for-service and with fee-for-service and Delta Dental, but not the DDIA Dental Wellness Plan adult program. Can we participate with Delta Dental DWP kids and not participate with DDIA DWP adults? Yes, that is one of the provider flexibilities that your office has the right to decide. Let's see, the next question is, not for prior authorization, requirements for general codes that require attachments for adults, will they be required for kids? So yes, I think we kind of addressed this already, but just keep in mind there are not a whole lot of prior authorizations for just kid specific services. They're kind of across the board. So if a crown is needed by a child that is less than the age of 18, it would be a covered benefit, and it would fall under that PA requirement, just like it does for the adults. So the same supporting documentation would be required to be submitted with that prior authorization and all that. The next question is if we are current provider for Delta Dental for adults, do we need to sign a new contract of DWP kids? Gretchen?
So as of, we just issued you an amendment to add DWP kids to your existing DWP adult contract, and so you don't need to do anything.
Okay, thank you. The next question is, I believe that to be participating with Hawkeye, you must be enrolled with IME. If we were not to participate with Delta Dental, MCNA, DWP kids, would we be non-participating with Hawkeye? No. Gretchen, do you want to handle this one, or?
Yeah, so that is correct. So Liz, as part of federal regulation, you have to enroll with Iowa Medicaid, no matter if you're a Hawkeye provider, DWP, or DWP kids. And so we would just make sure you're enrolled with Iowa Medicaid, which you are if you're participating in Hawkeye, and then you could just be part of our Hawkeye network.
Great, thanks, Gretchen. Which portal will hold the primary payer information, if any? Will we find it on the MCO sites for the IME site? Okay, so primary payer. Vicki, are you able to take this one at all, or from an IME perspective? Does the
I'm
else
not
line
quite
include-
sure what the question is. Asking primary payer information. Are they looking for third-party insurance?
Yeah, right. I think that's what the question is.
So that one I think would have to be, I'm assuming that we send over, just like we do to the MCO sites, we would send over any third-party insurance to Delta Dental and MCNA to show that they have a secondary one. And the primary one would be their primary insurance first, and because Medicaid is always secondary.
Right. So my question is if that information is available through the portal?
It should be through our portal. I don't know. I
Okay.
can't answer for the.
No. Yeah, I just wonder for the fee-for-service population if that was a.
Yeah, it should be listed there.
Okay. So I'm going to turn it over to Delta Dental and MCNA to see if you guys can answer this one on your end.
So Heather, we can take this offline, but I believe there was an informational letter that went out not long ago that when a Medicaid member is assigned to, whether it be a medical MCO or a dental plan, we now carry that third-party coverage information. That is not something that I believe is shared by IME. So once a member, like the children's population, would move over to the dental plans, I don't know that IME will continue to share third-party information.
Okay. Yeah, there was that informational letter. I think we have to share what we have. But the plan's validated. Does that make sense? So yeah, you guys would be the accurate source, the appropriate source for any primary payer information. Gretchen, do you have anything to add, or?
No, I don't have anything to
Okay.
add. They can find it on our site.
Okay. And I'm sorry, I'm just not too familiar with the provider portals, so I apologize if I didn't answer that correctly, but feel free to reach out afterwards. Okay, so this question. Currently, Iowa Total Care does not pay the anesthesiologist when we take our patients for general anesthesia. As a result, we are running out of places who will treat our Medicaid patients. Will Delta Dental and MCNA be reimbursing the anesthesiologist? So I can try to start this, and then please, Gretchen and Sabrina, jump in. So I will follow up with the managed care organizations on how they pay for dental cases in a hospital setting. My understanding is that they did pay for the facility and general anesthesia. That is something that is included in the capitation rate setting process for the managed care, the medical side. Again, the dental services themselves are reimbursed by the dental plans, but the dental plans don't credential hospitals. They only credential dentists. So they wouldn't be able to reimburse for the anesthesiologist services. Can I ask a Delta or MCNA if they want to add to that?
No, Heather, you're correct. The MCO should be paying for that.
Yeah, but that's good to hear. I will follow up on that because again, that wasn't my understanding, but I will follow up on that. Let's see. The next question is prior authorizations for ortho are now active for 2 years, and now it will be 1. I guess I thought we were a 1-year prior authorization as well. Delta Dental MCNA, have you had a recent policy change from 2 to 1?
Heather, this is Sabrina. I guess I'm not necessarily understanding Dr. Peak's question. Prior authorizations for ortho, once the appliances are placed, that service is reimbursable. And so I guess I'm not sure that prior authorization would need to be good for 2 years. Gretchen, do you have anything? Maybe we need more to the question.
Yeah, I think he can follow up with us afterwards. But yeah, like you said, once it's approved, they have a certain amount of time to, get that ortho completed with the member.
Okay. Great. The next question is when the patient has private insurance for medical, but not for dental, and the IME portal is not showing that the patient has other dental insurance, to whom the member has to call to remove that medical insurance from their portal. Does the IME portal always show that the patient has primary insurance or only sometimes? So this does relate to the question we tried to answer earlier. And
I can answer this one.
Oh, awesome. Thank you, Vicki.
If we have received information either from the member or through the files that are sent to Rev dealing with third-party insurance, it is placed into the MMI system and it is accessible through the IME portal. So the sometime piece is probably they have insurance, but it hasn't hit our system yet. And if they need to remove it, if the member is part of a MCO through, they would call the MCO to get that removed. No.
Okay. Okay, great. Thanks, Vicki. Let's see, my email address, Maria put in there. If anybody would like to reach out directly, you're more than welcome to. I can share, and like it was mentioned before, I think all of the answers to these questions will be shared. So we will follow up on the active provider survey Medicaid and share with everyone. The next question, currently for Delta, for Hawkeye, we bill out of ortho records, I think, with code D8660. So all records in one code. But for Medicaid, we have to bill separate codes for ortho, model, Ceph, and PAN. Will we now just bill out one code for records for Medicaid like we do for Hawkeye? And how will we bill for MCNA? I can I'll try to, or maybe I should just turn it over. Go ahead, you guys. I can start. My understanding is that we were going to keep the process the same as we did for Iowa Medicaid, and that providers would bill for those services individually and not bundled like Hawkeye does.
That is correct. That's how Delta is implementing or programming it currently.
Yep. And the same with MCNA, Heather.
Okay, perfect, perfect. Okay. The next question is, how can the provider find out when the patient's open enrollment time period is? This is something that we've been working on and hope to make more transparent, or hope to be more transparent with. You could definitely, and Vicki, is that something that they could call and find out?
Well, number
Or-
one, since we're moving all of the kids over, as you know, working with that July 1st date, all of those kids, as long as they don't go on and off, on and off and off, July is always going to be their open enrollment date. So
Okay.
the month that they come to people is usually their open enrollment date, unless, you know, they're not new. But as far as finding out, providers can call, and it is something we can, you know, we can tell, well, they're not in their open enrollment. They don't open enroll until this time, if they want to call in to find out.
Okay. Yeah, and I was just going to mention too that right now the dental plans are kind of in the dark about when a member's open enrollment period is, and that is something we're working on adding to a file exchange that we give them already, and adding that as a field that they can then try to do better outreach and education to members, as well as to the providers doing the same thing. So we will work on improving that process as we go forward here. The next question is, we currently have patients that have Delta Dental as primary, and I'm assuming Delta Dental Commercial as primary, and DWP Adult as secondary. Delta Dental automatically processes the secondary DWP Adult even without us sending in the claim. If we sign up for DWP Kids, how can we make sure that the DWP Adult claims will not be processed automatically? Gretchen?
So I can follow up if whoever put this in can send me a message. I think my email was on there, and I can follow up with you. But since we have commercial insurance for that member and the secondary of Medicaid, it would be a seamless process. So we would continue to adjudicate those claims for both payers, for DWP adults and DWP kids. But if you have more questions or comments, please follow up with me afterwards.
Hey, Gretchen, it's Dr. Chaffin. If I could just go a little further, that there's only one contract for DWP. So there's not a separate contract with Delta Dental for DWP kids or DWP adults. So if you are signed up for DWP and that adult has commercial and Medicaid, then it will automatically be adjudicated that way.
Great, thanks, Dr. Chaffin. Gretchen? The next question is, how will new ADA codes or certain code restrictions be handled? Will this be predetermined by MCNA, Delta Dental, or IME? Past code audits have been cumbersome and result in many denied or suspended claims. I'll try to kick this off, but please feel free to jump in, Sabrina and Gretchen. So we do work together annually to incorporate any new ADA changes, code changes into our programming. We are very close to handling processing codes the same way. In fact, yeah, the dental plans would have to cover a service if we decided to add it to our benefit package, or they would have to remove a service if it was removed from the ADA code of services. I'm not sure. And so sorry, let me back up. We do let providers know about these changes via the informational letter. And I believe the dental plans also offer education through their, newsletters and things like that to providers. Would either of you like to add anything else, Sabrina, Gretchen?
This is Gretchen. We try to, those January changes, we try to run scripts for claims that maybe were sent in a different code and just work to get those fixed. So those, end of the year code audits, we try to do that up front right away to make those changes if there's a different code or a new code that's being used.
Yeah. Okay. The next question is, right now, orthodontic interceptive treatment is paid out more dollars by IME than Hawkeye. Right now, orthodontic and interceptive treatment is paid out more dollars by IME than Hawkeye. Will Delta Dental of Iowa still only cover ortho interceptive treatment with the pay schedule used for the Hawkeye program? So I wasn't thinking there'd be any change to the Hawkeye program.
Yeah, Judy, this is Gretchen. You can, maybe we can follow up afterwards because there's really no change to the Hawkeye fee schedule or benefit. But if we need to talk through something afterwards, feel free to contact me.
Perfect. Great. Both Maria and Michael added the MCNA provider email. Nitrous oxide is a benefit with fee for service. Will nitrous oxide be a benefit with DWP kids? That benefit went away for adults with DDI DWP. So yes, for the kiddos, that is the benefit that will remain with this transition. Anything to add, Gretchen or Sabrina?
Nope,
Okay.
that's correct.
Okay. Will a panel for surgical extraction out of frequency be covered? Oof. MCNA or Gretchen, Delta, do you like to handle this one?
So when we're talking some exceptions to frequency, we would need to look at medical necessity. And so if you have, if there's a situation related to that, you would just send it in with the claim or through the inquiry process for Delta Dental.
Okay, great. If we are a provider for the wellness plan, but choose not to accept new patients within this plan, are we able to see them on a cash basis? I don't know. I don't think so. I think as a Medicaid provider, you have to accept. Oh, these member pay questions make me nervous. Let me follow up on this one just to make sure I communicate correctly, but my understanding is that no, they would not be able to be seen on a cash basis. Let's see. Adult wellness runs from July 1 through June 30th. Will kids be that way as well? Yes. So for kids that are coming from Medicaid to wellness, are X-ray frequencies based off the last ones taken under Medicaid, or will they be considered new insurance frequencies? The frequencies will still apply. So the dental plans will get a history. They'll get the member's history and they will apply the same frequencies. So all of those will remain. Does that answer that question, Gretchen? Sabrina, did you want to add anything?
No, I think you covered it.
Yep.
Okay. For prophy purposes, kids are considered adult prophys at 13. Hawkeye is at 14. At what age will the adult prophys be for a wellness kids? Oh, I might need to look into that one. I don't know the age. Rochelle Loftus, are you on the phone? Would you happen to know? No. Okay. I'm going to have to get back to you. I don't know the answer to that. I will look that one up. Okay, we currently do not send prior authorizations for children who need crowns with fee for service. It sounds like this will change. Could you clarify? We will need to submit prior authorizations for children who need crowns. Yes. That I guess I didn't realize that wasn't happening on the fee for service side, but yes, crowns for children will need to be prior authorized.
Hey, Heather, it's Sabrina.
Yeah.
I think it would just be good for all of the providers to go out and look at the prior authorization list you had in that informational letter.
Mm-hmm.
And those services will apply to all of us, to MCNA, Delta, and IME. And they're the same services that require a prior authorization in IME today.
Great, thank you.
And Heather, it's Dr. Chaffin, if I can just, I think there's some confusion. So like a permanent crown, a cast crown needs to be prior authorized, but not a stainless steel crown.
Oh, that's a very good point. Yep. Sorry if I confused anyone. Yes, stainless steel crowns do not require prior authorization. So yeah, thank you, Dr. Chaffin, for that clarification. The next question is, will there be training sessions for Delta Dental of Iowa and MCNA as we approach the July 1st deadline? Like how to use their individual websites, pay guides by code, etc. I'll let Delta go first.
Yes, we are planning to do provider trainings. We'll also be releasing newsletter articles, and like we referred to earlier, the provider manual will be out, and that'll be your, code by code, what is needed and what you're required to send in.
Great. Sabrina?
Yep. So MCNA is planning on doing provider trainings, and we are updating our provider manual and building provider bulletins and all of that right now as well.
Perfect. Okay. I think this is just a comment, maybe something, again, I will follow up on, but it sounds like there is an office that does provide OR care, and AmeriGroup and ITC do cover the OR and the anesthesia, and the PA is required. But again, I will look into that to make sure that I answered that question correctly. To my understanding, there's no change on the medical side for how those cases will be handled. There's a provider that says that she's only seeing the fee-for-service kids currently, and my adult Medicaid patients pay out of pocket since I don't participate in the DWP for adults. Oh, can I continue the setup with the new structure? Okay. Again, these member pay questions I need to take back. I just want to make sure I answer them correctly. So I will respond in written format on those. The next question is, do we get fee-for-service children coming to their, we get fee-for-service children coming to their appointments and presenting with primary insurance and Medicaid. When we have checked eligibility, IME does not show the primary insurance. Currently, we update this info to IME with their insurance update form. How could this be done with Delta Dental and MCNA? Sabrina, do you want to go first?
Yeah, I can go first. They can update that information through our provider hotline.
This is Gretchen. You can also send that information in when you send the claim in. So either way for Delta.
Oh, good catch, Gretchen. They can also do that for MCNA as well.
Thank you. Okay, Rochelle, I think she was just telling me, is this regarding the PA, I wonder? General dentist is 1 year, ortho is for 2. So the prior authorizations must be good for 2 years for ortho. Is that, I don't think I realized that. You know what, Gretchen and Sabrina, maybe let's just take that back for us to consider that policy. That'd be okay?
It sounds good to me.
Yes.
Okay, all right. Okay. Also, so somebody is interested in active providers overall and by county. We'll see if we can break it down by county for you. We are an extremely busy orthodontic practice and accept Iowa Medicaid located in Iowa City. We get referrals from Keokuk, Dubuque, Bettendorf, etc., and just can't accommodate them because of all of our own county patients. We are being told one ortho office in these areas accepts Iowa Medicaid. So how will this change benefit kids if reimbursement is no different to entice ortho offices to enroll? It's a good question. I mean, the reimbursement, I wish we could reimburse or increase reimbursement, but unfortunately, I don't have the authority to do that. It has to be legislatively directed. I know that reimbursement is a big issue for providers, and I know there's some movement in the legislature this year for wanting to increase rates across the board for dental providers and tracking that closely. But again, it just has to be legislatively directed, and I can't make those increases on my own, or even within Iowa Medicaid or DHS, we can't. Any ideas from the plans on how to entice providers to join? Okay.
So Heather, it's Sabrina. I think that one of the things that you had discussed in your presentation is the ability for the dental plans to be able to do some sort of provider incentive, and that has to be approved by the IME. So I think over the course of the next year, we'll all be very excited to have conversations about how we can maybe incorporate some sort of provider incentive.
Okay, great. Okay, let's see. Gretchen's email is there. Great. Sabrina, do you want to send yours out at all, or?
I can. I feel like if I type something, I'm going to miss the question.
Okay, then we'll do it later. Don't worry. Okay, so next question is, currently Medicaid pays for comprehensive ortho treatment in one lump sum. Will that remain? Also, interceptive orthodontic treatment is submitted quarterly to Medicaid now. Will that remain the same, or is there a possibility that it can be paid in one lump sum? Who would like to go first on this one?
This is Gretchen. I think we can take these questions back and
Okay.
have a discussion of, because we were planning to pay the 80, I think it's 80 lump sum, but we definitely want to make sure it's consistent between us and MCNA. So we will take back your ortho questions and include that in our provider manual and ortho guide when we get those done.
Okay, great. Sounds good. And I know we're running out of time, so I totally understand if people have to drop off, but is it okay to keep going, Maria and Mike?
Yes, I can keep the meeting
Okay.
going as long as you'd like.
Okay, we'll try to wrap it up here. Permanent crowns, correct, not primary crowns, so stainless steel crowns, yes, they do not require prior authorization. The permanent crowns do. Thank you, Rochelle. The adult pro fees start at age 13. Thank you for that. Okay, so yeah, I'll try to get some policy guidance out there for how and when members can pay for cash, when providers can bill members for services, things like that. I will follow up on that. Let's see. Oh, okay. Yep. 2 years for ortho. I'm sorry. I didn't realize that. I did not know that. Thank you. Will we be sending the answers out to everyone? Yes, we will. Yep, we will get that out.
So that they will be online. Mike, I don't think that we're going to send those specifically to all of the emails. Is that correct?
Sorry, could you repeat the question?
We are going to post this out online. We are not responding to everyone's emails that they have submitted with these questions and answers. Is that correct?
Correct. We're going to be putting together a frequently asked questions document using questions submitted today. And we'll try and consolidate questions and as much as we can so that it's a complete document.
And that should be going out if you can give us a week or so, depending on how quickly we can gather all of the questions that are posted today and get those out to the presenters that were here today to get those answered so that we can get those out. But if you do have any pressing questions that have not been answered today, there was emails provided. Also reach back out to the individuals that were presenting today, if that's helpful.
Okay. All right. Some more information about the research about the OR coverage at surgery centers from the medical perspective. Lakeview Surgery Center in West Des Moines will not see Iowa Total Care surgery cases, but they will see AmeriGroup because they do not get reimbursed for anesthesia facility. We reached out to the East Des Moines Surgery Center for OR times as well, and they said they
We do want your opinion on how this presentation went for you today, and if it was beneficial for you. So we will be sending that out probably by the end or middle of next, since today is Friday, probably by the end of next week, we'll be sending those out. So if you have just a few moments to answer that, we are here to help you. And it's obvious from the MCOs and Heather that they're here to help you through the process to make your life just a little bit easier. So we appreciate Heather and Sabrina and Gretchen, your time today and everybody's time today on the phone call, and we'll go ahead and send that out. If you should have additional questions, you now have email addresses. And also we will be posting those questions and answers hopefully within the next couple of weeks or so. All right. Well, thank you, Heather. I appreciate it.
Yeah, you're
Gretchen,
welcome. Thanks,
Sabrina.
everyone. Mhm.
All right. Have a great day.
Thank you. Bye-bye.
Thanks, Heather.
Thank you. Bye.